Good evening. This is Jason Brusky at KSB Hospital. I'm an RN and Patient Navigator. I want to thank you for joining me on tonight's presentation about managing Medicare Part D, or how to potentially save thousands of dollars on your medications. Some of you may have joined me last night and looked at supplement plans. If not, this is just to help deal with how to afford your medications. Who should have a Part D plan? Pretty much any Medicare beneficiary who does not have credible coverage. Credible coverage might be that you already have a Part D plan, you have a Medicare Advantage plan that offers prescription drug coverage, or you have credible prescription drug coverage, i.e. from an employer. You're still working or your spouse is still employed. Dual eligible patients like Medicare, Medicaid may be okay without it. Note, you may have limits to your treatment options without a Part D plan because Medicaid sometimes does not cover certain medicines that your Part D plan would. And you generally, if you're dual eligible, you have a really decent copay on those brand name meds too. So it is still highly a good idea to consider getting one. VA patients may also be okay without it because they often get their medications through the VA. It's just if you're in the hospital and we order a medication here, you have to get the okay through your VA doctor and go through a little bit of their paperwork to have it approved. But you don't take medicines. Why should I be spending money on a medication plan? That's a very good question. I get that a lot. Mainly, most Medicare beneficiaries will eventually need to be on medications. We buy car insurance and we don't anticipate being in an accident. We have house insurance. We don't anticipate our house burning down. So once again, it is insurance. It is to be ready in case you need them. Also, brand name medications and even some generics that have been orphaned start to become very, very expensive. And if you don't sign up for a Part D plan when you're first eligible and without credible coverage, you are subject to a penalty when you sign up for one later. So I don't take meds now, so I'll wait till I do. You're going to find some very potential premium penalties that you may find are going to cost you lots of money over your lifetime. So if you don't take medicines, I recommend signing up for the cheapest plan available so you have coverage. Because the penalty is 1% of the national base beneficiary premium. And in 2020, that was $32.74. So 1% of the $32.74 times the number of full uncovered months you were without credible coverage. So if you were 65 and eligible for Part D on January 2015, and waited until January 2020, you would have to pay $19.64 more per month for the Part D plan you select. If you lived until 90, you have given the insurance companies $4,713 in penalty premiums. At $15 a month for the first 5 years you waited would have cost you only $900 during that time. You are looking at a difference of $3,913. So by signing up for a plan when you're 65 on no medications and you live till 90 and end up on medications, you have put $4,000 in your pocket over that period. When to sign up? Well, when you're first eligible for Medicare, when your credible coverage ends. So you're eligible for Medicare Part A, you still have coverage through work, or you're on your spouse's plan, you may want to wait. But once that is going away, you should be signing up for your Part D plan. You can also sign up during open enrollment, October 15th through December 7th. This is also a great time to review your plan for next year to be sure it's the one that's going to save you the most money. Those who receive extra help, low income subsidies, or in Medicare savings programs have additional enrollment opportunities. You can learn more about those at the link that I've included on this slide. Signing up or changing plans. Medicare.gov has a plan finder. It allows easy comparison. You can also compare Advantage plans with this tool. I'll kind of point that feature out, but we're going to concentrate on the Part D plans. One thing nice about going to Medicare.gov, there is no pressure from an insurance broker. You go to a pharmacy and there might be a Humana rep trying to convince you to buy your Humana Part D plan or even switch you into an Advantage plan. And they're camping around at a lot of pharmacies during open enrollment. Might be good for you, but buyer beware. It's a great way to find a new plan. And I recommend going to this website every year during open enrollment to review the plan you have and see if there's an opportunity to save money the following year. Other ways to save money. Generally, taking generic medicines when available. More often than not, a generic medication, if available, will be less expensive than the brand name medicine. There's a few older medicines like colchicine and digoxin that are getting quite pricey, even though they're generic. Using nebulized medicines, if you have a Medicare supplement, these will be billed under Part B, which means you could get your equivalent of Symbicort or Advair if you have a good Part D plan for $203 for the whole year, which is less than usually 5 months worth of paying for your premiums in a Part D plan. Also, that means the cost you're not paying or the retail cost does not get applied to your donut hole. When comparing, include all the brand name drugs you take on the website. You may be able to omit your generic medications to save time. Honestly, with the ability to log in, you could put your list in, and I do believe the site saves it. So it might be the first time better just to put in everything you take, and then you can edit them later when you compare the next year. So that's why I mentioned creating an account can save you a list. I'm not going to create an account yet because I do believe I get some email reminders of when I should be shopping, and I'm not eligible to buy these yet. Insulin users can save a significant savings if you are in a plan participating in the insulin savings model. So if you are finding your insulin cost where you're paying $500 in January, then paying anywhere between $30 to $47 until you hit the donut hole, and then you're going up to $100 a month for your insulin this year, there's a plan for you next year that will save you considerable money. I recommend we're going to sort by the lowest drug and premium cost. This gives us our true cost of our medications and our Medicare supplement for the year. It's pretty much what we should estimate we're going to pay to have a Part D plan and the medicines we plan to take. You can also use this tool to estimate a newly prescribed medication during the year. You lost your paperwork that came with your plan, and the doctor wants to put you on a new brand name drug, and you're like, well, what will it cost me? Sometimes you need a script to the pharmacy for them to run it and then get back to you. Okay, we're now at the Medicare.gov website. Not Medicare.com. That is actually a business that actually has insurance brokers to help you select plans, and there may be some influence from them about the plans you should buy. The government site, it has a .gov, plus it has a little official website of the United States government and gives you a little link of how to confirm you're on a government site. If you checked out my presentation last night, you will see that we've been on this page before. We're going to go right down and find health and drug plans. And here's where we can log in or create an account. If you are a Medicare person and you're going to use the site to sign up for a plan and shop for plans, I would recommend logging in, creating an account. I am not of Medicare age, so I'm just going to continue without logging in. And right now, we're still only able to look at 2021 coverage. During open enrollment, you will actually be able to look at next year's plans. So if we are new to Medicare and we're signing up for the first time, or we just wanted to compare a drug that the doctor put us on, that's what we could do right now. In about 2 to 4 weeks, they will start adding next year's plans. And by October 15th, they will definitely be available because that's when you can start signing up for new ones. So we're going to go to right here, Drug Plan Part D. If I did want to shop or change my Advantage plan, I could do it by choosing that, but we're going to look just at the drug plans. They're based on zip code, so there might be a plan in Lee County that's available that is not available for a Whiteside County resident and vice versa. And Dixon, I happen to live in town, so I'm going to put I'm in Lee County. If you have Medicaid, supplemental security income, Medicare savings program, or extra help, you should check that because it's going to show you what plans you can get with those programs, and it's going to show you your co-pays based on those programs. If you don't know, you can click I'm not sure, and I'm going to click that we actually don't get help from any of these programs. And then it's going to ask you if you want to see drug costs when you compare plans. If you are on no medications and you don't anticipate starting any meds that year, I would put no. If you're a diet-controlled diabetic and you're realizing you're starting to struggle and you anticipate the doctor might be wanting to put you on Ozempic or something, you may want to put it in here even though you're not currently taking it, to get an idea of what plan might be best for you in the event that gets started. But we're going to say we do have medications. And I'm going to put in a few medicines here. I'm a heart failure patient today. And I'm on Entresto, which is a very effective brand name that improves the quality of life and life expectancy of a heart failure patient, but unfortunately, it's a fairly expensive brand name medicine. So that's the one I'm really worried about. But we're going to go ahead and add another one. And I'm on metoprolol succinate, which is a beta blocker. And I'm being treated, I have good kidney function and being treated with a medicine that is generally recommended by the academies for cardiac doctors and other organizations. So I'm also on spironolactone. So I'm on my ARB with sacubitril, I'm on a beta blocker, and I'm on spironolactone. And unfortunately, I also have diabetes because I want to show you something with insulin on here. So I'm on Levemir. Usually if you start typing, they do pop up for you. So if you don't exactly know how to spell your name, you can usually find it. And I'm just going to be on the basic one. But if you take a higher dose, you may have to adjust your pins that you take. So I'm just going to go with those medicines. You may be on more or lesser of these, but I just wanted to kind of put the insulin in there for a reason. And then I like to go a little broader than 10 miles for a reason. Come on. I like to go usually 25. And then I'm going to go ahead and get an idea of what it would cost if I use their mail order program, because some of these plans, it's significant savings going to mail order. Some it's no savings at all. It's just multiplying your retail pharmacy price for 30 days times 3. I'm going to pick a local pharmacy, Felkers. I usually pick the big chain pharmacies, your Walgreens, Walmart. The reason I went 25 miles, I wanted CVS to pop in here, because sometimes some plans offer significant savings at a certain pharmacy over the others. So I like to be sure. Maybe I have a great plan, but do I want to drive to Sterling to pick up my medications might be the question. And if the savings on my premium and medicines is enough, that might be worth it. From here, you can actually pick insurance carriers if you have a particular company, or you're just trying to identify your own because you wanted to check a new medicine. You could say narrow your search by putting your own down. You can go by star ratings. Generally, I will tell you most of these, going by cost, they all tend to offer very similar things. The only thing with a unrated plan is sometimes they don't last in the area the whole year. There was a group of people who bought a dynamite plan. I saw the premium, I saw the coverage, it looked great. And then in April, it announced to its customers that it was no longer participating in the Medicare Part D plan. So all those people had to find a new Part D plan. But because of the circumstances, they were considered an open enrollment period for them. Actually, CMS would have picked the plan for them if they didn't go choose one themselves. So they would have never been without a plan. And you have options here to go by lowest yearly drug deductible. So if you don't like paying at $445 at the beginning of a year, you may want the lowest drug deductible. Problem is the premiums go up. Lowest monthly premium. This is a great option if you're on no medications and you just want the cheapest plan so you have some credible coverage until you start needing medicines. But for most people, the option of lowest drug and premium cost is the best thing to choose. And what this plan is telling me right here, the Cigna Secure Extra plan, if I was signing up for Medicare because I retired and the meds I was currently taking, they have start billing under my Part D plan, they anticipate that this would cost me $355.44 for my premiums and all those drugs I type in for the rest of the year. If I go mail order, I save about $14. It does have a pretty high monthly premium of $54 and has a $100 drug deductible. So I have to pay that $100 for those brand names are there. I'm just going to click to compare. And you notice this one has a higher monthly premium of almost $20, has no drug deductible, but I end up still paying more for the rest of the year. So this plan, even with a high premium and no deductible, for a brand new person for the rest of the year doesn't save me any money. Problem is, come next year, I'm going to tell you this plan probably for 12 months, there'll be other plans with a lower monthly premium that will end up being a better plan, which you'll be able to find out when you do the open enrollment. When you see those comparing plans for 2022, then you're going to really find out for 2022 what plan. So if I was looking for money, and that's got 3.5 stars, and if you scroll down, you're going to see that seems to be pretty standard. And Cigna is a company that a lot of people are familiar with, so it's probably a really good plan to look at. I could compare it to other ones if I wanted to, or I can just go right to plan details, or I could directly enroll by clicking here. I'm a little bit of a cautious shopper. I would look at plan details before clicking enroll. So it's going to calculate based on those drugs. And it shows me my drug cost is $194.44 at retail, $179. And where that $344 came in, they were paying these monthly premiums for the rest of the year. It shows me which are my preferred and which are my standard network pharmacies. So I did put CVS in here because sometimes this is the preferred one, but I'm a Dixon person. So honestly, Walgreens or Walmart would likely be better choices if I were to go with this plan. As you can see, the cost of metoprolol is a big difference if you get out of your, if you go to a standard in-network to preferred in-network. And even some of these are even a little bit, it's funny that spironolactone is actually cheapest for retail at an in-network one, but looks like for me, Walgreens is looking at probably the best choice unless I want to go mail order. Incidentally, these brand name drugs actually do not apply to the deductible. This is how you know. It says I won't meet it. So this plan actually omits the insulin and the Entresto from the deductible. So that's a nice feature. Kind of shows me how much money I would expect to pay the pharmacy each month. In mail order, it's one big fee because it's for 90 days. I can actually break it down and look at Walgreens. And it shows me the retail cost of Entresto. I told you it was a very expensive med for increasing your length of life on heart failure and having better quality of life. It's a very expensive medicine, but has a $40 copay for me. Levemir, normally brand name drugs would have the same copay as the of $42, but this program participates in an insulin savings program, so I only have to pay $11 for Levemir. That's huge. And if you hit the donut hole in this plan for next year, this price stays at $11, where this one skyrockets to be $154.50. So it also even gives you an idea of what your donut hole coverage would be if you're going to be on this plan for a full year and how much it would cost if you ever make it through a donut hole. As you can see, generic meds on certain plans are pretty good to put in there because there is some cost saving for pharmacy, but a lot of plans have $0 copays for medicines like metoprolol succinate. So if you're on all generics, some of these plans you will have no copays too. So this is $4 at Walmart. You're on 5 of them and you end up having like a $30 cost of all generics. You may say, well, why do you need a plan? Well, if you might have a $15 plan and end up having $0 copays on those generic medicines, and you're going to save $15 than just paying cash at Walmart. I can, if I want to, add or delete medications from here. Just by clicking that, it gives me the option to make changes. Also shows me basically this plan has a preferred generic copay, a regular generic copay, a preferred brand copay, non-preferred brand 50% coverage. So if Entresto was non-preferred, it would cost me over $300, and tells me what tier these drugs are in. Even though Levemir is a tier 6, because of the insulin savings program, it becomes not an issue. So that actually, for me, if I was shopping and had these medicines, very, very promising. I could just click enroll, and I would leave the Medicare.gov site and end up going to the Cigna site, and I can sign up online, or I can call the number as a non-member and sign up if I want to talk to a real person. I like online shopping, so I would just do this online myself. If I'm a current member and had questions, it gives you a current number to call if you're a current member. I'm going to go back to search results, though. Remember, I told you how you can save thousands of dollars. I want you to take a look at the Cigna plan, and I'm going to move down the list and show you some of the other plans that are available. So this plan, premium of $54, I will tell you, is pretty steep in a general world, but for the rest of the year, based on how it covers my drugs, is wonderful. I'm going to scroll down to the end of the page. And this one, half the premium, but I'm also paying twice as much overall for the rest of the year for my medications. One reason is this has a $445 deductible that I have to pay. So it's not going to cover my Entresto until I pay this deductible. This one's even cheaper, but once again, because of that deductible, this one would cost me a lot per year. That being said, maybe next year, beginning of the year, this WellCare Classic or this Clear Spring may be a better option because of the lower premium cost. The difference between 15 and 50 is about $35 multiplied by 12. We're getting into this deductible range. But I'm going to go to the last page here because they put this in order of cheapest to lower for calendar year. So if I just grabbed a plan that I thought, hey, I like that company, and I wanted this AARP Medicare Savers Plus. I was an AARP member. I jumped on this. Coverage was okay. Well, I'm going to tell you it doesn't cover a lot of these medicines, and because there's a $2,277 cost between now and the rest of the year. So this would actually cost me almost $2,000 more if I had this plan compared to that Cigna. So based on just the name or premium alone is not a really good way to do this, but I'm going to show you really quickly why this plan would not be good for me to start for these medicines. We're going to go down and see how much that Entresto cost. As soon as it calculates this, it's going to give me a really good idea of why this plan for my medications is not a very good choice. And it is because it does not cover Entresto and it does not participate in the insulin savings plan. So look at this. It's going to charge me $1,700 for Levemir and $541 for Entresto. So putting your meds in and using that ability to go from lowest premium and drug costs is a great way to save thousands of dollars when you choose these plans. In conclusion, purchase a Part D plan when first eligible. This will allow you to avoid the premium penalty. There is no reason to give an insurance company extra money because you didn't want to, because you have to pay a premium. I met a pair of brothers who had the same plan. One had his plan when he was first eligible. The other didn't think he needed one. And as he was struggling to pay for his insulin and also buy groceries, we started shopping for plans, and he managed his brother's financials because his brother had Alzheimer's. He goes, why don't I just pick my brother's plan? I know about it and it does a good job for him. So we contacted the company, and he had to pay $30 more a month for the exact same plan because he signed up late. It still in the long run saved him money because it helped pay for his insulin significantly, and he's able to afford his groceries and insulin. So it was still a good move for him. But to pay $30 a month for life for the same plan his brother had just seemed like a shame. And he was unaware that he would have been subject to a penalty if he didn't sign up right away. Compare plans yearly, just prior to or during open enrollment, to be sure that the plan you currently have works for you again next year. Entresto users were on SilverScript 5 years ago, and it was an awesome plan. Low premium, no deductible, nice $45 copay. Hit the donut hole towards the end of the year, but it wasn't that bad. And it was the cheapest plan for someone on that medicine during that year. If I go this year and put in that same medicine, it's in the middle of the pack when I look at them, ranking from the lowest to the most expensive on drug costs per year plus premium. So it is a good idea to check your plan every year. If you have an Advantage plan with medication coverage, you should still compare the plans yearly, because same thing can happen with Medicare Advantage plans. It may cover your medicines really good one year, but the next year it may change significantly. I've seen people save $200 to $600 by switching Advantage plans on medication costs. Once again, Medicare.gov has an easy-to-use plan finding tool that allows you to compare plans without any pressure from a company trying to get you to buy their particular plan. You can create an account to save your medication list to make comparing year to year easier, so you don't have to start from scratch typing everything in. Check with providers if you can take a generic equivalent. Maybe you don't need the brand name drug because there's something generic out there. That's another way to save some money. One, a $42 copay compared to that $4 copay is a big difference. The other thing is the amount of money that gets applied to the donut hole is much less on a generic medication. Also, if you have a good Part B supplement, I recommend use nebulized medications to replace your Spirivas, your Symbicort, your Advairs, and other medicines like that, because that will save you significant copays. It will make sure those drug costs don't apply to putting you in the donut hole. Once again, if you have any additional questions, you may contact me at jbrusky@ksbhospital.com. You can call my office number directly. I often am not at my desk, so you'll have to leave a message, but I will return. Or you can put any questions in the comments and we will review them and get back to you later. Once again, thank you for joining me on this important topic on how to save money on your Part D plans and medications.